Orthopedic surgeons in Kelowna are pushing back against the provincial government's recent claims that the province has caught up on its surgical backlog from early in the pandemic. In Kelowna alone, there are over 1,200 patients on the orthopedic surgical wait list, with more than half of them having now waited over a year and another 900 patients on the list in Kamloops.
We're dealing with a large backlog of surgeries from cancellations during the pandemic. And it all stems from staff shortages. When the hospital gets shut down, the operating rooms take a large hit. Our nurses have had to be redeployed to other areas of the hospital.
Dilworth noted that the hospital lost a number of nurses during the pandemic, many of which left the profession.
Unfortunately, orthopedic surgery is labeled as elective, which unfortunately has become synonymous with unimportant. And we are the low-lying fruit when it comes to cancellation. And we understand it's not life-saving, it's not immediately going to cure cancer or make a heart beat again, but it is life-transforming.
Dilworth says patients on the orthopedic surgery wait list are suffering in pain, causing their quality of life to diminish.
It's really hard to watch, actually, because you'll meet a patient and they're using a cane to get around and they're taking Tylenol once or twice a day. And if we got to their surgery in 3 or 4 months, perhaps that's all they would have. But then they wait longer, and then they need something more for pain. And then all of a sudden they're using a walker. Perhaps they've now gone to a wheelchair. Now they can't go to work, so they lost their job. They become depressed. They become reliant upon narcotic pain medication. And so we've taken somebody who was a contributing member of society to somebody who can't even function on their daily tasks, chores, work, everything like that.
Dilworth requested a meeting in a letter to the Minister of Health on behalf of the BC Orthopaedic Association to discuss the state of orthopedic surgery in the province.
My goal right now is just to raise awareness about what the situation is for patients across British Columbia waiting for orthopedic surgery, and to come up with a plan and to reach out to the health minister and ask him to sit down with us as an organization.
In addition, she would like to see the health minister sit down with all medical departments to work on a recovery plan to get back on track.
Because we're still not operating at full capacity, and if we do operate at full capacity, that doesn't mean we're catching up. We're just maintaining the status quo of what it is today.
Surgeons are also pushing the province to use private surgical clinics to help clear the backlog. Victoria Famia, Castanet News in Kelowna.